All right, so we're going to get into healthcare self-funding overview. For many of you on the call, this is the most enjoyable purchasing experience that you have in your business. And if you can't hit the sarcasm there online, this is basically what we see across from us when we're delivering insurance renewals in the fully insured world. We understand that the employers are facing the challenge of offering robust health insurance coverage to attract and retain employees while maintaining costs. And we know that the current model is unsustainable. It is not allowing you to attract and retain your top employees, which are your most important assets. There is no transparency in the fully insured world. And it is, again, one of the most frustrating purchases of the year. It creates anxiety. And what we're trying to do is demystify the risk of going self-funding. So today's agenda, we're going to talk about what's driving healthcare costs. We're also going to talk about the growth in the self-funding market. We're going to compare self-funding to fully insured. There's going to be some slides that I'm going to put up that will illustrate just how less risky self-funding is versus fully insured. Also, we're going to get into how these group self-funding models work, how they're structured. But most importantly, just going self-funding is not the only strategy going forward. We're going to give you some cost containment strategies that you can implement as you're moving towards a self-funding strategy. So let's take a look at the healthcare market, shall we? It's no secret, costs continue to rise. And why are they rising? That's the most important thing that you have to understand is why are your health insurance renewals rising? First is specialty drugs, right? There are a lot of specialty drugs out there on the marketplace, and they're really, really game changers as far as helping your employees manage their health. And also, they could be life-saving therapies. But with life-saving therapies, there's a significant cost to it. And we give you an example of Humira could cost the plan anywhere up to $95,000 a year. There's also an increase in the number of $1 million claims, and that usually comes in the form of either gene therapy or cancer treatment. With the inception of the ACA, they have removed the lifetime caps. So what has that done to plans? It has increased utilization on the plan itself. It has also created more costlier treatments because there's no lifetime cap on the treatment of any one individual. This has spiked premium increases across the board, and it has had a major impact on premium increases in the fully insured world and in the self-insured world for that matter. Another thing that you're seeing in the healthcare industry is this thing called vertical integration. What is vertical integration? It's in healthcare, it's where a single entity or an organization controls various levels of the healthcare delivery and payment chain. An example of that would be a physician group that gets acquired by a hospital or healthcare system. And because you see more and more vertical integration going on in the marketplace, we're seeing that drive healthcare costs up because, number one, there's reduced competition. There's also a lack of incentive for cost control and anti-competitive practices. Another thing that came out from the Affordable Care Act is the medical loss ratio. And it was a well-intentioned provision within the ACA that requires insurance companies to include offering group health plans to spend a certain percentage of premium revenue on medical care and healthcare quality improvement. Now, it was praised right out of the gate. It was like, hey, we're going to hold these insurance companies accountable, that they're going to use 80 to 85% of the premium that they collect to pay for healthcare services. But insurance companies are in the business to make money. And if they are required to spend a certain percentage of premium revenue on medical care, it does beg the question, what is the insurance company's incentive to reduce your healthcare costs for your plan members? The incentive is gone. So as healthcare costs go up, so does the profitability of insurance companies. So again, a well-intentioned process or provision within the ACA, but it has had a negative impact on employer-sponsored health plans. So with all these challenges that are going on in the healthcare marketplace, it has led to a great growth in self-funding in the marketplace. And why is that? Why is it better to possibly go to a self-funding plan from a fully insured plan? Well, if you look at most small to mid-sized businesses, the overwhelming population within the group, within your specific group, is relatively healthy. 90% of your population is in that healthy at-risk category. And that only makes up about 20% of your cost. But it's the chronic and the catastrophic that is driving the majority of your healthcare spend. But because you have no access to claims data, you do not know what is going on within your plan population, it's hard to help employees get to better healthcare outcomes, which is ultimately driving your costs. Because in the fully insured world, there's less claims data to analyze, or there's no claims data to analyze. And when you get hit with your significant renewal at the end of the year, and it's 60 days out from your renewal, it's usually, well, we don't know why you're having this increase. We know that there's probably claims, but we don't know what those claims are. And we have no way of controlling the cost other than to look at another carrier. But more often than not, the costs are the cost, and we have conditioned the overwhelming population that buys group health insurance that that's just the way it is, and there's nothing you can do about it. And that's just not the case, because group self-funding or standalone self-funding has allowed companies to gain greater control over their health insurance costs. It makes it more budgetable. You are able to develop strategies, which is some of the things that Jeff talked about, to drive your healthcare costs down and reduce your overall healthcare spend. So if you look at healthcare costs over the decades, it's significant. This continues to go up and up and up for both single and family coverage. And what is it doing? It's shifting more risk to the employer, but it's also shifting more risk to your employees. And if you don't have to be a financial wizard to look at these graphs. This is not a sustainable model for any business. You have to be able to look to something different and change the way you're purchasing your insurance. And I love this slide because this kind of illustrates the point of why self-funding is a better model, in our opinion. Carriers actually prefer you to be a fully insured member. You are worth 5 times the operating profit than a self-insured member. So the bottom line is, it's a big problem and you have little control. But going self-funding provides you that level of control. So let's talk a little bit about what self-funding is. It is a financing mechanism structured to pay as you go for all covered medical and pharmacy claims. And the perception is that self-funding is only for those Fortune 500, Fortune 1000 companies with thousands and thousands of employees to spread the cost of risk around. Well, now with these group self-funding models, employers as low as 25 insured lives, probably around that 50 insured lives or more, could transition to a group self-funding plan that operates much like your fully insured plan, but provides you a lot of the benefits of going standalone self-funding. So it's not just for the big guys, right? You have to realize that as you're growing in your business, fully insured, there's different transitions you can get to self-funding, and we're going to get into that a little bit in this presentation, but you need to develop a strategy on how you're going to transition from fully insured to self-funding. And it starts with picking your third-party administrator. Well, Brian, our employees, they love Blue Cross Blue Shield, they love Aetna, they love United Healthcare. They don't want to see their plan designs change. You don't have to, okay? Because in a self-funded world, you get to choose your network and who you work with. So Meritain Health in the middle there, that is an Aetna company. Blue Cross Blue Shield, they have independent administrators, or Highmark. United Healthcare has their own administrator as well. So you get to choose in a number of different networks as you're evaluating your self-funding options. And as you can see, the percentage of employers nationwide have actually already made this transition to self-funding. So if you are in any one of those categories, and I would tell you that those categories and the percentages are actually probably a little bit more now, but you're trying to reach that, what Jeff talked about, that best-in-class status from a business perspective. So it's time to kind of get off of that fully insured treadmill. So I love this slide. This slide tells a different story than what it kind of reads. So if you look, we put down on the lower end fully insured plans, lower risk end, fully insured plans. And then on the greater risk, we put standalone self-funding. I would probably argue that it's actually more risky to go fully insured than it is to go to a partial self-funding or a level funded or a group self-funding plan. Because as we said earlier in the presentation, year after year after year, you are going to see an increase in your health insurance. And that model is just not going to be sustainable. So it begs the question, is it riskier staying the status quo? Or is it riskier trying to do something different so you can gain control over your health insurance spend? In my view, I would probably say, in Jeff's opinion as well, it is less risky to go to a group self-funded plan than it is to be fully insured. So this talks about the compounding effects on renewals. So on the left side of the slide, you have fully insured. And in year one, let's just say you have a bad year, right? Again, you don't have any evidence of that because they're not sharing claims data, but you have a bad year. What does the insurance company do? Of course, they're going to hit you with a large increase that year. But the next year, you follow it up with an average year, much less than what you did the previous year. Now, if you have been in fully insured, you have been conditioned that, hey, I didn't hit you with as many claims as I did the year before. I should see a reduction in my health insurance premium. Should I not? Well, no. That year becomes your new floor. And then they give you a small nominal increase the next year. Then you hit them with a good year. And what do? They hit you with a moderate increase. On the self-insured side, you know exactly how your plan is going from year to year. So when you have that bad year, yes, you may pay more for insurance the following year. But if you have a good year, you will have a surplus that you can use to pay down your health insurance spend. So you have a better control just in the model of self-funding than you do fully insured. And how do we help you gain control? Fully insured, you have little to no control over your benefit levels year to year. More often than not, they're taking your current plan, they're adding increased costs to your employees and to the employer, all right? And your renewals are developed by actuaries that work for the insurance company. They do not work for you. In self-funding, you maintain your benefit levels each and every year. Your premiums are based on your individual member experience, and your renewals are developed by actuaries that work for the members, not for the insurance company. Surplus on fully insured, if you have a surplus, number one, you probably wouldn't know that you have it because they're not providing any level of claim data anyway, but that is retained by the carrier. That's their profit. There's no ability to control how that surplus is going to be managed going forward. In self-funding, that surplus is retained by the member. And there's a full disclosure of all surplus. And each member has control now on how they want to manage their surplus. They can keep a portion of their surplus. They can keep all of their surplus. They can use a portion of the surplus to pay their future renewals. But that surplus is in your pocket, not in the insurance company's. Protection. In fully insured, your renewals are retrospectively rated. What does that mean? So your prior loss experience will dictate what your future loss experience will be. Renewals on the self-funding, while there is some retrospective rating, there are also some prospective rating, because you may have a plan participant that had a high health insurance expense. Let's use a NICU baby as an example, right? That's going to be $1 million claim. But now that the baby is healthy, there's no ongoing cost in the NICU unit. When they look at that claim in self-funded, they're going to say, well, we don't have to account for that cost anymore. The baby's doing fine. So we are not going to get our pound of flesh on the renewal, because we know that most of that claim was ceded to a reinsurer. Okay. Also, in fully insured, there are no caps on renewal increases. If you've been in a fully insured environment and you get hit with a 60% renewal and have no way of knowing why they got there, that's why. Because again, there are no caps on renewal increases. But in self-funding, we can put caps on the stop loss premiums increases each year. We can build that into the contract. We talked about transparency, no claims data shared with members, or very little claims data shared with members. In self-funding, and this is why Jeff's proposal was relevant to this proposal, is we want to be able to predict where our costs are going, so we can create a strategy to better maintain or control those costs. Well, you don't have that in fully insured. You do in self-funding. So you know where every dollar is being spent, and you know exactly what is driving your renewal pricing. And then there's savings in self-funding. Higher administrative costs in fully insured, no immediate savings from claim cost reduction, and there's just high and unstable renewals. In self-funding, lower administrative costs, immediate savings from claim cost reduction, and low and stable renewals year after year after year, creating more predictability and more budgetability for your health insurance plan. So now we're going to go to a group self-funding model and show you how it works. But before we do that, I want to talk about how traditional fully insured plans are structured. Okay. All costs are fixed. There are no variable costs. So you know what your monthly and your annual premiums are going to be. But all the underwriting profits go to the carrier. So much like self-funded, you're going to have a claims fund in your fully insured plan. And then they're going to have their administrative fund that sits in excess of the claims fund. That could be all the taxes and fees, the admin costs for administering the plan. It could be cost of reinsurance that you are not aware of. Okay, so that is what a traditional fully insured plan structure looks like. Let's compare that to a self-funded structure. Okay, so you're going to have both fixed and variable costs, and the underwriting profits will go to the client. So in this structure, we have same claims fund, but we are going to purchase either standalone or in a group self-funded program, specific and aggregate stop loss insurance. In addition to that, we will have a portion of our premium go to the administrative fund. And when we have member surplus, if it's a great year, we're going to keep a lot of money. If it's an expected year, we're going to have a portion of the money. But let's just say we have a really bad year, okay? That claim fund is going to be exhausted, and the rest of those claims will be ceded to your aggregate stop loss insurance. So the program itself provided protection in a bad year, but it also gave you the rewards of a good year of insurance? So let's do that by percentage of premium, okay? 60% of every dollar of premium that you pay will be put into your claims fund, leaving you with another 40% to go to your stop loss insurance and your administrative fund. So if we're doing our cost structure based on $1 million of traditional premium, 600,000 goes to your claims fund, 300,000 goes to your specific and your aggregate stop loss, and another 100,000 would be your administrative fund. So how does that look when we're talking about claims? So this next slide talks to you about what we would consider a good year, right? So we're going to set our specific deductible. So the fund is going to pay for all claims at or below $40,000 spec, all right? If we have a $500,000 claim, all right, 40,000 of that $500,000 claim is going to be paid by the claim fund. The rest of that claim, that $460,000 of that claim, will be ceded to the reinsurer or the stop loss carrier. Okay. Now, as the year progresses and it closes, we've had claims that were $500,000 of claims below the specific deductible. That is allowing us to have now a surplus of $100,000 in surplus that we now are able to use for our benefit, not the benefit of the insurance company. But you're probably wondering online, like, okay, those are great years, Brian. What about when we have a really bad year? What does that look like? So we're going to give you a claims worse than expected scenario. So same thing, we have a $500,000 claim. 40,000 of that $500,000 claim is going to be captured in the claim fund. That's 600. So you have $600,000 still in your claim fund, and then the rest of that claim is going to be ceded to the specific stop loss carrier. But this year, claims blew up, as they can from year to year. All right, and you have now 800,000 of claims that are below the specific deductible, giving an overage of claims. So your claims fund is now exhausted. In that scenario, that 300,000, or excuse me, that 200,000 overage would be then ceded to your aggregate stop loss. So now you're protected, but nothing's changed with your premiums for that year. You still pay the same monthly and maximum premium in that calendar year. Now, it begs the question, well, Brian, I get it, but won't this increase my insurance rates the next year? I said, yeah, it absolutely would. But I would even ask the same question. Number one, you know where your premium is being spent, all right? You have a good understanding of your claims experience and how you might be able to direct your employees to be better consumers of their plan, and we'll get into that later in the presentation. But is that better than being in a fully insured where you have no knowledge of how the plan is being spent or utilized, and you have no idea, how you can help your employees become better consumers of the health plan? And you're going to see a large increase in a fully insured in this same scenario. So yes, you're going to see increases from time to time in self-funding, but you're also going to see large increases in fully insured in this scenario. So again, back to a previous slide, what's riskier? Being in this scenario where you're self-funded, or being in this scenario where you're fully insured? In my opinion, self-funding is a better model. So let's talk about a case study. This was with one of our nonprofit clients. They had about 115 employees on the plan, and I love this. They got a 0% increase due to positive claims performance from the fully insured carrier. And we have been conditioned, all right, or I would say as consumers of the health plans, we have been conditioned, we got a 0% increase. Man, this was awesome. like, why would we want to make a switch when we're getting a 0%? I would tell you that if you only got a 0% increase in fully insured, your plan must be doing so well, and it must be so profitable that they don't want to upset the apple cart. So they gave you a 0% increase because they, again, see the profitability in you. You're 5 times more the operating profit if we keep you fully insured. So this is not a 0% increase, isn't good, in this scenario. It was bad. And if we could move you to a self-funded plan, which we did, and we feel like our claims experience would perform better than expected, we would generate a surplus. So we moved them to self-funded, and we made no plan design changes, no employee contribution increases. And after 48 months in the self-funded program, their surplus has exceeded $450,000. And that surplus is now being used to further the organization's mission as a nonprofit fund. So it's not enough when you're going to a self-funded model to just participate in a self-funded model. There are strategies that you can implement in a self-funded plan that you're not able to implement as well in a fully insured plan. So we're going to get into each of those categories in the next few slides. So the first is the pharmacy benefit manager carve out. We're also going to talk about transparency and data analytics. This is why it dovetails very well with Jeff's presentation, because there is a lot of analysis and financial planning that goes into what Jeff does. But part of the healthcare insurance renewal process gives you that level of transparency, gives you that level of data so you can make more strategic and actionable decisions. We're also going to talk about concierge services, particularly for your high-cost claimants. We're also going to talk about direct contracting that you can have with different providers to reduce your healthcare spend. And then last but not least, we're going to talk about advocacy services, both COBRA and Medicare. So if you are in a fully insured plan, your pharmacy benefit manager is your insurance carrier's pharmacy benefit manager. And you have no ability to break away in a fully insured plan to a different pharmacy benefit manager. But in self-funded, you get to carve that piece of it out from your network. And what PBMs are they're third-party entities, and they play a significant role in managing your prescription drug benefits for your health plans, employers and organizations. So PBM carve-outs are a practice of separating or outsourcing your specific pharmacy-related services or functions from the core services offered by a PBM. And what is the benefits of a PBM carve-out? Number one, cost control. You can help PBMs control costs by leveraging their expertise of specialized vendors and reducing the need for in-house resources. And within that, you also get specialized expertise from those vendors. They're more comprehensive in the specialized services to their clients and members. There's also greater complexity within PBMs that the PBM provider can help you navigate through those complexities. And the last thing is transparency. So they provide you what it's costing you year after year after year on your pharmacy spend and how you can reduce those costs. So here's an example of a professional service client of ours. They had 125 employees on the plan. We transitioned them to a standalone self-funding years ago. Their total prescription spend was a little over $330,000 a year, and the pharmacy was already carved out. But when we got involved in the process, we repriced their prescription drug spend, and that generated anywhere between $60,000 to $100,000 of annual savings year after year to year. And if you look at the slide, you'll see that in the current PBM model, they were paying $332,000 and some change. But as we carved it out and we looked at different providers, the biggest expenditure was on the rebates. So the rebates were not going back to the employer, they were going to the PBM or the insurance company. So we wanted those rebates to come back to us. So $67,000 were returned back to us. But through other things that the PBM provider was able to do, they were able to offer even additional savings in a number of those different categories. Next is transparency and data analytics. It plays a huge role in improving the management and outcomes of self-funding. Cost containment. You have to be able to identify your cost drivers. How are your, what is driving your healthcare spend year after year after year? In fully insured, there is nothing that they can share, particularly if you're under 100 lives, that can show you how your plan is being utilized. And is it being utilized effectively? What are some things that we could implement to help our plan participants utilize the plan better, also help them manage their health better? And do we have actually the right plan design? Should we look at different plan designs to optimize the effectiveness of the plan? Even in data analytics and cost containment, the more you can put into your claim fund, okay, the more variable expense that you have, the greater return on investment you may get by taking on additional risks, because that additional risk that you're taking on, you're not spending more on specific or aggregate stop loss insurance. So being able to look at all that data and saying, hey, we're at a $40,000 spec deductible, we're performing really well. What if we raise that to $75,000 spec deductible? What is our claims experience over the last 3 to 4 years? And is it worth taking that additional risk? You can't get that in fully insured. You can only get that in self-funding. So again, having that level of detail on claims and how you're performing year after year can create that predictability in your health insurance renewals. We talked about pharmacy benefit management. Again, having a PBM that's giving you that level of transparency is important. And the last thing within transparency and data analytics is that employee engagement. Because we have an understanding of how the plan is being used, what type of pharmaceuticals are being used, we have a better way of engaging our employees on how to better utilize our healthcare dollars and their healthcare dollars for that matter. So, getting to that granular level of detail allows us to put more education in front of the employees that directly impacts them, not just generic education that is typically developed in a fully insured plan. So here's an example of transparency and data analytics. So we had 109 manufacturing client, 109 employees on the plan. We transitioned them to self-funding in 2015. At the time, they had 7 high claimants totaling in excess of $1 million. However, because we were able to see the data year after year after year, they were able to achieve over $500,000 in surplus over a 5-year period. Okay, so again, it sounded risky when we went in, okay, but because we were able to get that level of transparency and that data, we were better able to educate them on how they can structure their plan. And also we were able to better engage their employees on how they can optimize the plan more efficiently. So whether you're fully insured or whether you're self-funded, you will have high cost claimants, okay? And if you looked at health insurance renewals over a 10-year period, 8 of the 10 years, you're going to have great years. Your workforce is going to be relatively healthy. You're going to be profitable, but they're going to have those 2, maybe even 3 years of a 10-year span where you're going to have some high cost claimants that are driving your healthcare spend overall. But what you can do in those scenarios is provide a concierge service for high cost claimants. So high cost claimants require a significant medical care and treatment, and it's very complex. The healthcare system is very complex. They may need to access a number of different specialists, pharmacies, and because of that, we shouldn't reasonably expect employees to be able to navigate that system well. So actually outsourcing these and providing a concierge service for all plan participants in the event that they get hit with a very poor medical diagnosis, to have a resource that they can go to help them navigate the healthcare delivery system. And more often than not, with high cost claimants, it's not just about helping them reduce their spend, right? It's a part of it, but it's not all of it, because in some scenarios, we might want to shift them to the highest cost provider because they have the best outcomes for that employee. So, and because we want to get better outcomes for our employees, we're willing to spend a little bit more upfront for that employee, knowing that the chances that those costs will get reduced over time because now we're helping the employee manage their healthcare better. That might be an effective strategy. And that's where a third-party concierge service can help that employee get to the right care at the right cost and work with the different providers and making sure that all of them are working in coordination with each other to the benefit of the employee. If you're talking about an attraction, a retention tool, and unfortunately, you have an employee that is hit with a poor medical diagnosis and you can provide them concierge services to help them navigate through that, you're going to have raving fans within your organization because your employees will feel like they're better taken care of by you, the employer. So this is an example where we had 115 employees on the plan. There was a 32% increase because of one large claimant that was at $300,000 in claims every year. That's what they were costing the plan. So we transitioned them to self-funding, and we negotiated with the provider to cap those claims at $180,000 each year. And that generated about an 8% decrease in claim fund savings. And then, that plan then generated $140,000 in pharmacy rebates. So again, that's not possible in fully insured. Moving them to self-funding, we can have those negotiations up front. Because we help them manage their healthcare spend better, they received actually a 4.2% decrease on their renewal. And then the subsequent year, they received a 9.2% decrease. So 32% increase year after year after year because of one large claimant, because of our negotiating power and an ability to work with a concierge service, we were able to negotiate lower costs for the employer and better outcomes for the employee. So direct contracting, it's a strategy where an employer or plan sponsor can negotiate directly with healthcare providers, such as hospitals, clinics, or physician groups, to provide healthcare services for plan members. And it provides a lot of benefits, but most importantly, cost savings. So you can negotiate directly with the providers on what you're willing to pay for these services in an effort to provide your employees a good resource for their healthcare needs. You can also customize the benefits within those direct contracting contracts. And then this also improves the quality of care, the access to care. You get to see just how well these providers are performing to your benefit, better cost predictability, data access and analytics, and you're also reducing the administrative spend. So we've seen some really good things with direct contracting as part of a overall risk management strategy. And here's a couple of examples, right? Surgical, laboratory, and imaging pricing. If you're able to have a direct contract for your employees, it could save anywhere from 5 to 15% on average. So, for example, you have an employee that goes to the emergency room to get an X-ray or an MRI, that could be pretty costly. But if it's not an emergency and they can go to, say, an imaging center, that would have a better outcome for the employee, number one, and it could provide a better cost savings to the employer. Okay, so having those direct contracting relationships set up, it could have a significant impact saving on the health plan. Another example is dialysis claims management. It could, end stage renal disease claims, they are really expensive. And, having those direct contracting, the situation set up, can actually yield a significant savings for just one patient alone. It can roughly yield about $60,000 in savings. So hopefully you don't have a lot of employees on end stage renal dialysis, but typically you'll have maybe one or two, depending on your population. But if you do, this is a good way of getting them to the right care at the right cost, and also that helps you on the back end by saving money. The last risk management strategy that we implement for our self-funded clients is in COBRA and Medicare. Now, we do this on fully insured as well, but it has a greater impact on self-funding. This requires careful planning and communication. You can't specifically direct people to COBRA and Medicare, right? But you can educate all employees, particularly the ones that are leaving or on COBRA, or leaving or staying on the plan, to move to COBRA. It might be in their best interest to do so. So providing those analysis of going to COBRA or going to Medicare for all employees that are maybe eligible is an important thing to do at every insurance renewal. So we do informational sessions or webinars to address the questions or concerns of the individual, and then we develop a transition plan for them. So prior to the renewal, we would maybe come out and provide that COBRA or Medicare informational session, and that may attract somebody who's eligible for COBRA or Medicare to move and transition to there at the renewal. Why do we want to do that? Because more often than not, your highest cost claimants are either on COBRA or they're Medicare eligible. So the more we can help employees transition to this and get off of our plan, the better. So, but this is just case studies, but on average, we're saving, on Medicare advocacy, we could save between 2 and 4% to the plan. Same thing with COBRA advocacy, we could, average savings is between 4 to 8%. As we say in the presentation business, oh, but wait, there's more. I did provide a little bit of a bonus. This is really not caught on yet, but we do see it in other parts of the country. So in this part of the country, we have not, but reference-based pricing is a cost containment strategy used in self-funding plan that sets payment rates for medical services. And it's based on a reference point. Usually it's a multiple of the Medicare rates, and what it does is it creates greater predictability and budgetability for all medical services. So if you've ever been in either fully insured or self-funding, we really don't know what the costs are when we go to a provider, right? The cost could be different from one provider to the next. But if we set the rates of this is what the plan is willing to pay for these services, and the providers that are providing the services would have to adhere to that pricing structure, that creates greater budgetability. Now, the reason why it hasn't caught on, recently or as much in this marketplace is there's a tendency for providers to balance bill the employee for the cost of those services, and that can get really scary for employers, because the employees are saying, oh, they're saying I owe all this money for healthcare, my healthcare spend. They don't, but that is a practice that providers do, and again, the reason why it hasn't caught on is there's a lot of fear around, disrupting employees and it's scaring them. So again, Will this catch on eventually? I think it will. Again, the model is not sustainable, in the current structure of fully insured. So reference-based pricing will eventually probably catch on in this marketplace as it has in other parts of the country. So kind of just to sum up the advantages of self-funding, it eliminates most of the premium tax. I think is between 4 to 6%. Lower cost of operation because of the carrier profit and risk charge is eliminated. Stop loss protection for the large claimants. No new laser contracts, and we really didn't get into this, but in standalone self-funding, there's a risk of plan participants being lasered. So if you're a high cost claimant and you're in standalone self-funding, what the stop loss carrier can do is saying, okay, for the group, we're going to give a $40,000 spec deductible, but on Joe Smith, we're going to give a $200,000 spec deductible. Okay, and that gets really scary for employers to be able to cover that delta, that cost for one plan participant, knowing that they're going to have that spend year after year after year. So in group self-funding contracts, we can build into the contract that there are no new lasers going forward for future high claimants. So if somebody develops cancer and they're going to have a significant spend, the spec deductible will not change for that high cost claimant. All right. Now your reinsurance costs may go up as a result of it, but you're not going to be stuck with paying a significant claim fund bill. In self-funding, there's more effective claims processing. The prescription drug rebates, as we talked about in a PBM carve-out, can go to you, not the insurance company. You get to control your plan design. In fully insured, there is no control. Year after year after year, you typically are going to another plan that provides more cost to the employees and more cost to the employer. Here, you get to keep your plan design. And in many cases, being in a self-funded model, you get to improve your plan design changes. You may even be able to improve the employer's contribution to the health plan and less to the employee. Your state mandated benefits are avoided. There's obviously that enhanced reporting and data analytics that is key in self-funding model, and there's multi-year administrative fees. You get to the larger administrative fees are fully insured. The smaller administrative fees are in self-funding. So that is all for today's presentation. On behalf of Jeff, I'd like to thank you guys for attending, and we're happy to answer any questions that you may have.